Well, good day to you. This is Greg Downing with Texas Medicare Advisors here in Leander, and today we want to help you with your prescription drug plan and help you save some money. All right, so you should have already gotten your notice from Medicare about the changes to your prescription drug plan, and what you will find out is they're going up. Now, we're right here in the annual enrollment period, which starts October 15th, run through December 7th. That's when you can change your drug plan. You can change your Medicare Advantage plan, but has nothing to do with your Medigap plan or your Medicare Supplement plan. All right. Now, most plans, as I said, are going up. We're going to show you how to shop all those at Medicare.gov. So, what we know now is there's 22 different plans to choose from. And the only way you're going to figure out which one's right for you is by putting in your prescriptions, and that will select a plan that works best for you based upon not only your prescriptions, but what pharmacy you want to use. All right, so I'm going to show you how to do that. Now, we need your help. We are blessed to have thousands of clients. We love you all, but there's no way we can help every single person shop their drug plan in 52 days and do everything else that we've got to do during the annual enrollment period. So if you can help us by helping yourself shop for these plans, it'd be awesome. Plus, we get paid like next to nothing to do these things for you, but they are very important. You will save more money shopping your prescription drug plan than you will trying to save money on your Medicare supplement plan. All right, so we have to let you know we don't work with every single plan that's on Medicare.gov. These are the ones we work with. Aetna, SilverScript, which are all owned by CVS, Blue Cross, Humana, United Healthcare. These are our main plans that we work with. The other thing I'm going to try to briefly go over with you is understanding how your Part D prescription drug plan works and the different stages involved with that. Alrighty, so let's do this right quick, and the way we're going to learn how to do that is we go to Medicare.gov. Let me get out of here. And here we are at Medicare.gov. Now, this is letting you know what's going on, the new law. What's happening is they are trying to improve the Medicare plan, which has good points and bad points to it. One of the things that was always an issue with my clients was shingle shots. Everybody was always mad because it cost $300 to $400. Well, that no longer is the case. That's covered at 100% under the new law. That's the Inflation Reduction Act that the Biden administration put together. So that's one thing that happened in 2023. Also lower costs for insulin. You can read all this stuff. But what's driving costs this year is in order to lower the out-of-pocket costs for individuals, somebody has to pay for it. It's not the insurance companies are going to pay for it. It's the rest of us. But some people will get benefits out of these new laws and regulations. One of the things, and I'll explain it later, is catastrophic coverage. Also, 2024, more people are going to qualify for low income, and that's if you're at 150% of the poverty level or less, you can get your costs reduced. And the big thing is starting in 2025 is they're saying they're going to cap people's costs, maximum out of pocket, at $2,000. We'll see how all that pans out. Bottom line is somebody has to pay for this, and it will be you, all right? So let's go back, and you can read all this stuff later. But right now, let's go back to home, and we want to shop. He's very happy. I don't know what he's happy about. Shop, find health and drug plans. So if you'll click on this, it'll load right here. All you got to do is put in your zip code. Loading. Continue. It's already pre-populated with the 2024 plans. And then you want to look for a drug plan. You want to find plans. I don't get any help. Next, we're going to add. Now, I've already added my drugs in there just to save time. So, but all you do, if you wanted to add another drug, you just start typing in, whatever you take. And it'll pop up. Da-da-da-da. Let's say we take some of that. You enter it in there, add the drug, add a generic. All right, that's the way it works. Anyway, we're not going to add that because I don't take that. All right, so we're done adding. And we are going to go back to my list. We're done adding drugs. I like HEB Pharmacy. You can put in whatever you want, CVS, Walgreens. You can compare them, but I know I want to get my stuff at HEB. We want to keep all this stuff simple as possible. You hit done. Now, I've already looked at these plans, and the way that they work is they're sorted by the lowest drug plus premium cost. Overall lowest cost based upon your pharmacy. And in this particular situation, Blue Cross just ends up being the better one, okay? But let's say that I was on Silver Script currently, so I want to compare that one, and then just for grins, I'll compare another one. And this helps you understand the real difference in the cost. So if you look at the Blue Cross, Silver Script, Cigna plan, you will see the premium, the deductible, but this is the main thing you're looking at, is your overall annual cost. $1,600 with Blue Cross, $2,200 at Silver Script, and $3,100 with Cigna. It's kind of a no-brainer. You're going to pick this one unless you're just like to give away money. So then what you can do, once you get that, is you can look at your plan details, and it's going to give you the premium, the deductible, your annual cost of each one of these prescriptions. The thing shows you when you will meet your deductible. That's in 2024 in February. When you'll enter the coverage gap, that's going to be in October. When will I get out of the coverage gap? I won't. It ain't going to happen. So this is important. You look at what's your total. Well, this is just your prescription cost for the months, January, February. So you can see it a whole lot in January and a lot less, and then it stables out at 52. And lo and behold, it starts to jump up at the end of the year. And if you're like any sane person, you're going, what is craziness happens here? All right, well, let me try to explain some of this stuff. And it is complicated. But if we looked at my 3 prescriptions, one of them is real cheap, $3. Cost before deductible, $3. After deductible, $3. It's the same, doesn't make any difference. Here it does, Eliquis, $520. Yikes. After the deductible, $46. So it goes to a lower copay. And then Rovastatin, $3. So what this tells us is if I didn't have this Eliquis on here, I wouldn't have to worry about a dang deductible. I just pay $6 a month and go on down the road. Anytime you take a prescription that's advertised on TV and people look really happy, it's going to cost you a lot of money and you are not going to be happy. Now, cost after deductible, cost in gap. This is where everybody gets confused, including myself. So the way it works is in 2024, once you, the insurance company, and the government have contributed $5,030 on your behalf to buy these prescriptions, you get kicked in the donut hole or the coverage gap. And the simplest way for me to explain that to you just means you're going to pay more money when you're in there. Now, if you came out of it, which it shows I won't, but this is part of the new law, is once you come out of the coverage gap, which is, the magic number is $8,000 that everybody's contributed on your behalf for your medications, you go into the coverage after the gap and you owe nothing. It used to be 5%. Now it is nothing. The challenge is most of us never get out of the, we stay in the gap and then the new year starts. So that's just the way that works. I could talk for hours about this, but I don't want to because I don't like it. All right, so here's what we're asking for you to do. If you could please try to do this on your own, and if you can find a plan that works for you, if it's better than the one you have, just call us, let us know what it is, and we will get you set up for 2024. All right, thank you so much for your time to listen. We appreciate it. All of our clients here at Texas Medicare Advisors here's wishing you a great day, and we will be in touch soon. Take care.